Good afternoon. Welcome to United News Australia. Tonight's special. More than 20,000 Sudanese people living in Australia have fled from Sudan and South Sudan to escape drought, famine, and warfare. This has had a serious influence on the health status of Sudanese population groups, which includes nutritional deficiencies such as vitamin D. This vitamin is essential for health, well-being, and sustaining bone health. It is also essential for optimum calcium absorption and maintenance of phosphorus and calcium balance. Vitamin D deficiencies can lead to increased risks of disease such as multiple sclerosis, cardiovascular disease, muscle weakness, type 1 diabetes, hypertension, and certain cancers. Individuals with low bone mineral density levels are more likely to have lower vitamin D levels. In addition, a low education level is also a major risk factor for Sudanese refugees. More specifically, research reveals a correlation between women who have not completed high school and severe vitamin D deficiencies. These refugees have also been exposed to nutritional risks prior to migration, which when combined with changes associated with acculturation can impede upon their health and nutritional status post-migration. Darker-skinned individuals are also at risk of being vitamin D deficient, especially if they receive little sun exposure. Dietary changes, limited nutritional knowledge of Western foods, and living a sedentary lifestyle are also potential risk factors. Nutritional deficiencies in itself are also a risk factor for many other diseases and illnesses, such as anemia, tooth decay, and osteoporosis. Cultural and religious beliefs are thought to contribute to vitamin D deficiencies in Sudanese refugees. The main religion in Sudan is Islam, in which it is a common practice for females to wear clothing in which only their face, feet, and hands are exposed. As our main source of vitamin D comes from exposure to sunlight, various studies conclude veiled women are more at risk of vitamin D deficiencies. Vitamin D can also be accumulated through certain foods. There are several environmental and personal influences determining the diets of Sudanese refugees. Finance is a common cause influencing diets, dictating limits of foods people can eat or have access to. Low level of knowledge regarding nutrients and vitamins present in foods are also a large risk factor for vitamin deficiencies. The civil war in South Sudan has resulted in the destruction of schools and workplaces, thus limiting access to health education and minimizing health-seeking behaviors.
That's a great question, Liz. Language barriers are a main issue, often resulting in miscommunication, misdiagnosis, and lack of appropriate follow-ups, leading to Sudanese refugees turning or being turned away from adequate treatments, meaning there is a lesser chance refugees will continue to seek health services. There is also a large dependence on fluent healthcare providers and interpreters for communication purposes. Australia should be encouraged to expand on these resources in smaller refugee communities. Finance presents a probable barrier for Sudanese refugees, as healthcare services offered by allied health providers or private specialists are charged as fees outside the Medicare rebate. Sudanese refugees could turn to seek access to hospital outpatient services to receive this type of healthcare. Cultural discrimination and mistrust barriers are also an issue, in which limited reliance on health service providers can constrain certain access to essential healthcare. It is important to understand how mistrust can arise and how this can be avoided.
Okay, and what about enablers present for Sudanese refugees?
Well, health professionals should be encouraged to interact, cooperate, respect, and develop trusting relationships to help facilitate the health-seeking behaviours of Sudanese refugees. In addition, providing healthcare facilities in which Sudanese refugees have access to specific interpreters or language assistance. This could encourage an increased rate of attendance to other health services and a more tailored healthcare provision, which stabilises a safe and sensitive environment. Community education programs are also working towards increasing refugee service utilisation through community and education outreach, with programs such as the Sudanese Australian Integrated Learning Program and the Refugee Action Program. These can help to prevent nutritional deficiencies